Just last month, the Iowa Department of Public Health and the Department of Health and Human Services merged.
And now an assessment is underway to determine what can be streamlined statewide. KCAU 9 News photographer Kenneth Kroll was at a town hall meeting where area organizations came together discussing the future of Siouxland's social services.
The details are in our top story tonight at 6.
So we're really discussing the realignment that is being proposed by the Iowa Health and Human Services. They've realigned a lot of our programs, community programs, under HHS. And now they're talking about reorganizing everything. They're doing like a statewide assessment of all the programs.
Realignment process at the merger of the Iowa Department of Health and Human Services and the Iowa Department of Public Health.
HHS has hired an outside evaluator to come in and to assess all of the programs that are statewide. So every community has these entities, and they want to do all of that in a 3-month process, which really, when you think about it, something like that, to get really meaningful feedback, really needs to take at least a year, maybe 2, maybe more than that.
But in such a short time frame that it's hard for a place like Woodbury and Ida County and the surrounding counties that are so collaborative. It's hard for that assessment to happen so fast because we have such embedded in each other's services. Because we work together in partnerships, it's hard to piece that all out and decide what needs to stay and what needs to go.
We are looking at preserving services to our residents. We want to make sure we begin to meet their needs, that we serve them appropriately. And I think that's one of the challenges we have is we don't know how this process could either negatively or positively impact that sort of core function that we want to do. We want to be at the table to work with them to develop a more functionally efficient system. We don't disagree that there's inefficiencies, but many times we feel the frustration, and those come from the state level, and an inability to make some of the changes that would better serve us to serve local residents.
My fear just really is, in such a short time frame, how are we able to really get a good look at what's happening and what we're able to do. I just don't think it'll be a clear enough picture for us to be more effective, and I just don't want to lose families in the gaps of what the fallout is here.
If we still have to work with that truncated timeline, they don't extend it. I think what we want to do, and the purpose of this today, is to let our stakeholders, our legislators, our decision makers know, these are our programs, this is our community, this is our collaboration. And so when they're faced with making a decision based off that evaluation, a proposal, they'll make the right decision for our community.